Graduated from the University of Rochester School of Medicine in 1980. I became an orthopedic spinal surgeon, did 10 years as a military surgeon, and then I served on a congressional committee that looked at technology for the military, for the Navy specifically. And as that, I researched bioweapons and all sorts of stuff and masks. And I'm going to tell you, in my entire professional career, I have never heard anybody actually believe that any kind of masks, short of an actual level 4 containment suit, made a difference to small particle viruses. In fact, the CDC itself just published an article in May exactly saying that. You cannot contain influenza with these masks, and that's even larger than this virus. Now, I reviewed all this science. I gave a talk out in Nevada last month, and it's online, YouTube, Medical Technocracy in my name, and you can look at all the sciencey stuff. My conclusion, looking at all redoing my investigation into this time, is that people that are now purporting to scientifically prove masks work are either being paid or being played. This just doesn't work this way. And, you know, the outcome of this is not going to be good. The previous speaker said some of the things I wanted to say about children. You know, children actually, we have bad things happening here because children learn by looking at facial expressions. They socialize. We are creating a generation of people that will be afraid of normal existence, and that's not a good thing. The second thing is, I don't know if you know how badly you're damaging the economy. You guys haven't missed a paycheck, but as a small business owner, we've missed a lot of paychecks, and it's not getting better particularly because I live outside the ring of Omaha. And you know, when you live outside there, you don't have to wear a mask. We're not social distancing. We're all hanging out with each other, and nobody's getting sick any more than they did last season. The actual survival rate this season is 99.991%. It's actually gone up to probably 99.997 with the new CDC revelations. And last year's flu season was 99.992%. And for that, we're making our children afraid. And that's not a good outcome. So I think this is time to end this. And I just want to say that I've taken 2 oaths in my life, one to the Constitution as a naval officer, and one to the oath of Hippocrates when it says I shouldn't do mischief to my patients. And mischief includes lying to them. I'm just not going to do that anymore. I'm not wearing a mask, and I guess I won't be shopping around if that's necessary. But I think it's time that even you guys could turn this around. You're either going to ride the city down or you're going to turn this around, and you can do it right now. I'm just reminded of Boris Yeltsin's, you know, this lie is going to fall apart here pretty darn soon. The truth is coming out. And Boris Yeltsin once said, you can sit on a throne of bayonets, but you can't sit on it for long.
Thank you.
So thank